Hi, Sal. Can I just start by asking you to introduce yourself?
Yeah, so I'm Dr. Sal Peterson. I'm a GP over in Scotland, and at the moment, I'm the primary care cancer lead for NHS Tayside.
Can you tell me what's changed and what's covered in the Haematology Suspected Cancer Referral Guidelines?
I think the first thing is that we need to be clear that although these are particularly based with adults, and there is a further section about children and young people, then there is always going to be a link with haematological cancers and children and young people. And there's some really good data about the specific types, and it does fit very much about the three main hematological cancers. So looking at leukemia, lymphoma, and myeloma. Really great information about clinical assessments and some really clear information about tests that we can do to help support referrals within primary care. The bit that has changed is about the emergency and same day discussions for leukemias and myeloma. Rather than it being a USC referral, the guidance says that we should be either admitting a patient or speaking to our local haematologist. And that might be something that you need to look at for your local pathway. I know where I am, we're asked to speak to the on-call haematologist to discuss that straight away.
Is that when you've got the results of tests, or is that when you're thinking about things?
That's probably when you've got the results of tests and you're expecting or quite clear, because what's shown on the combination of symptoms and investigations, you're pretty clear that that's what the diagnosis is going to be.
Is there guidance on how to interpret the results? Because I know for things like myeloma, it's something that causes quite a lot of anxiety.
So the two things with the myeloma that it gives you is it does give you, and with all of them actually, it gives you a really good overview of the not only the specific symptoms. So you might have heard of the CRAB diagnosis for myeloma, which is your increase in calcium, your renal impairment, anemia, and bone pain. But it also gives you the systemic symptoms that you'd be looking for, the weight loss, the night sweats, and that side of things. It also then will move on to the investigations that you can do, but those sometimes are quite specific. So, for example, we can get the protein electrophoresis, and often a lot of the laboratories will give you really good guidance about what that means. Which then means that you can discuss it with your local team.
And then what about, so we've talked about myeloma, what about lymphoma? What's your guidance on assessing lumps?
When looking at what it guides about the lymphoma, there's a few bits and pieces. There's the initial when you should be thinking about people when they've got lymphoma. So what are the systemic symptoms? What are specific for lymphoma? There's also the bit, because sometimes this comes up unexpectedly on things like CT scans or MRIs. So that's something to consider about how that then is processed within your local pathway. But the other thing that it does talk about is unexplained lumps, and particularly lymph nodes within the pathway. They usually say, I think it's more than 2 centimeters for 6 weeks, that these should be considered as potential lymphoma. And there does need to be some understanding of the local guidelines. Some places you can just refer in, or some places you can actually get an ultrasound and they'll refer directly for biopsy. So that's something to check out for your health board.
I think you've said that on some of the referral guidelines as well, you've got a practical points area. Can you tell us what's included in that?
Yeah, so in the haematology one, the good practice area, we've mentioned about other diagnoses such as considering HIV. So on a couple of the guidance, particularly with the lymph nodes, I think it's the leukemia one, they do suggest that we should be doing HIV testing as well. They do talk about the increase of lymphocytosis and paraproteins, but again, they're quite clear that this isn't it wouldn't be an urgent suspicion of cancer referral unless there are these what they call additional features, which are more systemic features, which is your weight loss and your night sweats, fevers, that side of things. There's a really good discussion around safety netting. So sometimes we will have these symptoms with patients. Initially, everything will come up absolutely fine, but making sure that patients will return should things change, get worse, or not resolve. There's some interesting information about splenomegaly, which might come up on CTs and ultrasounds. And apparently there's a calculator which can help you consider whether this is something worrying or concerning. And obviously, although we've only covered 3 areas of the haematological cancers, there are some rarer ones, and there's some really good links in the referral guidance so that you can look into some of the rarer haematology cancers that might be around.